Hi, I'm Dr. Watt, the healthy neurosurgeon. I want to talk to you about why vitamin D is the single most important hormone in your body. Now, you've probably just said, wait a minute, you said vitamin D, and now you're saying hormone. I know, it's a little bit of confusion. A hormone, by definition, is a signaling molecule. It's a messenger in your body, usually made one place and it travels somewhere else to send a signal to say, do something. A vitamin, by definition, is a substance that the body needs and it can't produce, or it produces it, but not in an adequate amount. Now, vitamin D was historically labeled a vitamin. And yes, it's true, we make it. So you can say, well, that goes against being a vitamin, but most people don't make enough of it. So why is it we don't make enough of it when I'm saying it's the most important hormone in our body? The problem is our biochemistry is approximately 50,000 years old. We haven't had any recent evolutionary changes. So what does that mean? Basically, it means your body, your biochemistry, your physiology thinks, if you will, that you're in the tropics. As a matter of fact, you're buck naked in the tropics and you've never met a dermatologist. No sunscreen, no rash guard, no floppy hats. That's the way you make adequate vitamin D. Whole body exposure to very intense sunlight. The further north you go in the northern hemisphere, the further south you go in the southern hemisphere, the less intense the sunlight becomes. And so, again, evolutionarily, we started out in the tropics, then we wandered out of it. Fine, the real estate was better, maybe, but it came at a price of less sunlight, not just less intense sunlight, but shorter days, longer winters. Then along the way, the dermatologist came along and decided that sun exposure caused skin cancer. Now, we'll discuss another day how what you're eating, specifically vegetable oils and sunscreens and sunglasses, are what's driving skin cancer, not sun exposure. But again, topic for another day. So the dermatologists come along and they say, put sunscreen on. Well, if you're putting the sunscreen on, what's it doing? It's blocking the ultraviolet light, which is the signal to tell your body, make vitamin D. And then they say, put on a big floppy hat, put on a long sleeve shirt, maybe wear sunglasses. And all of these things are inhibiting your body's ability to make vitamin D. Even if you're smart enough that you're not all lathered up in sunscreen and you're out in the sunshine, again, if you're living anywhere in the northern latitudes, you can't get enough. It just doesn't work. When I was in medical school, admittedly a million years ago, one of the great mysteries of life was that multiple sclerosis, an autoimmune disease, is a disease of northern latitude. The further north you go, the more multiple sclerosis. It's a known fact. Nobody knew why. More MS in Chicago than in Denver. More MS in Denver than in Dallas. Way more MS in Winnipeg than in Chicago. More in Fairbanks than in Winnipeg. Well, what else is going on? As the further north you go, the less sunlight you get, and it turns out the lower the average vitamin D level, assuming that the majority of the population is not taking vitamin D as a supplement. So, vitamin D level goes down, autoimmune disease goes up. Well, why, you might ask? Let's back up a minute. I started by saying vitamin D is the single most important hormone in your body. Big statement. And admittedly, I tell all of my patients your hormones are like a symphony orchestra. You need everybody to show up and play their part when they're supposed to play their part for the song to be right. So I'm not saying vitamin D is the only thing that matters, but vitamin D is vitally important for your bone health. Most people know this part. Vitamin D is also very, very important for brain health. Low vitamin D causes depression, seasonal affective disorder, when people become profoundly depressed in the wintertime. They're not sad because it's cold and snowy out. Their vitamin D level is pitiful to begin with. Winter comes, less sunlight, shorter days, more time inside, more clothing. They're already low vitamin D tanks, and they get clinical depression. Low vitamin D also predisposes to dementia. Even more importantly, vitamin D is the single most important modulator of our immune system. This is why it's really important. Why is cold and flu season in the winter? Less sun, less vitamin D. The population's vitamin D level is already pitifully low. Winter comes, the low level gets even lower still. Your immune system doesn't work as well. Cold and flu season. The cold virus doesn't go to Belize in the summer. We're just a little bit more resistant to spreading it around when our average vitamin D level is a little better off. What else is your immune system involved in? Oh, yeah, autoimmune diseases. So low vitamin D, poor immunity, more multiple sclerosis, more rheumatoid arthritis, more Hashimoto's thyroiditis, more systemic lupus erythematosus. All of the autoimmune diseases are more prone to strike you if your immune system is impaired, and it can be impaired just by low vitamin D. Here's the part nobody wants to think about. We are all sitting here right now, this very moment, making cancer cells 24/7. Your immune system is like the bouncer at the door of the club. He says, you get in, you don't get in. You make the cancer cells, and your body is supposed to recognize that as foreign, attack it, chew it up, destroy it, so you don't get cancer. If your immune system isn't working right, the cancer cell sneaks around the bouncer under the velvet rope, sets up shop at a VIP table. Now you've got a cancer. So if it has to do with whether or not you become osteoporotic, if it has to do with whether or not you get an autoimmune disease, if it has to do with whether or not you get depression or dementia, if it has to do with whether or not you come down with an infection of any kind, not just a cold, but all infections. And oh, by the way, if it has to do with your likelihood of getting cancer, then why wouldn't you think that vitamin D is vitally important for your health? Because it is. By the way, another topic for another day, all of the COVID nonsense. But the data that came out of Germany showed the number one predictor that a patient was admitted to the hospital and went to the ICU with COVID was a vitamin D level below 30. One of the hospitals in Germany was very forward thinking. When people came into the hospital very sick, they gave them vitamin D in an IV form. Nobody spent more than one night in the hospital. Everyone went home fine. Okay, so we have to support our immunity. We can't support our immunity without vitamin D. So what are we going to do about it? Well, like I said, sunscreen causes more cancer than sun exposure. Now, you don't want to get sunburned, so you have to have a prudent way of dealing with exposing yourself to the sun without overdoing it. But again, if you're in Chicago, even when it's not smoky out, and you're laying out buck naked in the backyard, you're not going to get enough sunshine. It's just not going to work. So what do? You have to take vitamin D. Now, everybody says, well, fine, how much vitamin D should I take? My glib answer is enough. Now, luckily, there is a blood test to measure your vitamin D level. It's called 25-hydroxy vitamin D. It's very, very important you get this test done. Most mainstream primary care doctors never check it. They should, but they don't. A lot of insurance companies aren't willing to pay for it. It's not the most expensive test in the world, so even if you're out of pocket, you need to get your vitamin D level checked. Now, what do you do with that number? It's important to understand that reference ranges are woefully inadequate. Everything in the world plots out in a bell-shaped curve. You lop off the tail ends and you say, that's normal. What you've really said is that's average, give or take a standard deviation. And you have to also say, well, what population were you measuring to get that bell-shaped curve and lop off the tail-shaped ends? And if the population you're measuring already has low vitamin D to begin with, what's going to come back as average, i.e. normal, may not actually be a healthy amount. So how do we know where we want our vitamin D level? Well, let's go back again to buck naked in the tropics. One of my professors in my fellowship in anti-aging medicine works in Southern California. So he went over to La Jolla and he rounded up all of the lifeguards. Okay, Southern California lifeguards, a bunch of 20-somethings in really good health. They're just this side of buck naked in their Speedos and bikinis. They're not big fans of sunscreen, and they're exposed to Southern California sunshine. So intense sunlight, whole body, no sunscreen. At the end of the summer, their vitamin D levels averaged 93, and none of them were taking vitamin D. That's just what their bodies made naturally in a condition that basically recapitulates what our 50,000-year-old biochemistry thinks is normal for us. So if the lifeguards do 93 without taking anything, I want my vitamin D level to be between 85 and 95. So how do we get there? Well, obviously you need a baseline. Check your vitamin D level. Now, if you wanted to run out and get vitamin D first, okay, that's fine. You can take me at my word that if you're not taking vitamin D, your level's probably low. But it's nice to have a starting point. So you check your level, and it comes back maybe scary low, 25, or just pitifully low at 35, or really inadequate at 50. So then what do? You get a good quality vitamin D. Now, the FDA is not our friend. A few years ago, they did say one thing that was true. Nobody is monitoring the supplement industry. Now, I think they said that to try and sell more prescription drugs. But it is caveat emptor. So I'm not going to recommend a particular brand, but you want to be a little careful about what you get. If you just pull something off of the shelf from Safeway that probably came from China, you don't know what you're getting or what the potency of it is. So you want to go with a reputable company and a good quality brand. And it's vitally important that your vitamin D is mixed with vitamin K. Vitamin D and vitamin K are kind of like Thelma and Louise. They just like to hang together. In honesty, what happens is the absorption improves. Vitamin D, when you take it in a pill, absorbs better if you're taking it with vitamin K. And for your bones, vitamin K has an independent signal that it sends to tell your body, take that calcium and put the calcium in the bones. Don't put it in the arteries. Don't put it in the heart valves. Don't put it in kidney stones. Put it in your bones. So you want a vitamin D mixed with vitamin K from a good quality company. And you start taking vitamin D, one pill daily. And I recommend taking your vitamin D at bedtime. Vitamin D is not a sleeping pill. It won't knock you out. It shouldn't make you drowsy, but it deepens sleep. Sleep is when our body does its healing and its repair. And a lot of people have trouble sleeping anyway. So if you're going to take it, and if taking it at nighttime helps you sleep better, then why not take it at nighttime? I typically start my patients on 5,000 international units a day. Now, that's not what you have to take, and it may not be the right dose, okay? Some people might need less. Most people need significantly more, but I tell all of my patients, you have to start somewhere. So you get your level done. If surprisingly your level is 80, I'm going to say probably good enough. Ride the horse you've got until winter comes. But assuming your level's low, which is a safe bet, start taking your vitamin D. Then what? Well, you got to start somewhere, but unless God whispers in your ear, you don't know if the dose you've started on is the dose that's right for you. So you give it 2 or 3 months and you check your level again. Here's where your insurance company will pitch a fit. Here's where your mainstream doctor will push back because they don't want to pay to do a second test in the same year. But how do you know if the dose you're taking is putting you where you want to be? So stomp your foot, insist on it. If need be, pay out of pocket, check your vitamin D level again. Say you were at 25 and you're taking a 2,000 unit pill every night, and now your level is 45. Well, that's better than you were, but it's still not where you ought to be. So again, this is self-evident. You need to take more. You can take 2 of your 2000s, you could get rid of the 2000s and get a 5000, but you go up on your dose. And until you get to the dose that's giving you the perfect level, you keep rechecking. Doesn't have to be exactly every 3 months, but you need to be periodically looking. I really don't think it's a good idea to only check your level once a year, especially because even though I've spent a lot of time telling you we don't get enough sunlight in the continental United States, you're still going to get more in the summertime than you are in the wintertime. Or if you spend the winter in Florida and the summer up in Chicago, you may actually be getting more sun exposure during the winter. So your body's still going to be trying to make it, provided you're not slathered up and cut with sunscreen and covered up with clothing to make your dermatologist happy. So it's important to recheck your level and at least do it in the summer and in the winter at a minimum, and adjust your dose. Try really hard to get up to that 85, 90, 95 range, because again, if the healthy lifeguards can do that without taking anything, why wouldn't we want to recapitulate that? So at the end of the day, your vitamin D, it's a hormone. It's a signaling molecule. It goes to your bones and says, get stronger. It goes to your brain and says, don't get depression. Don't get forgetful. It goes to your immune cells and says, fight the cancer, fight the infection. Don't come down with an immune dysregulation disease like multiple sclerosis. Yes, it's a vitamin. Your body makes some, but doesn't make enough. Check your level. Start taking vitamin D. Recheck your level. And by the way, vitamin D is probably the poster child for potency of low-quality brands to fluctuate. So if you just go to Safeway or Kroger's and you pull a bottle off the shelf and you're taking it and the number really doesn't move at all, then I'm sorry you wasted your money, but the brand you're taking is worthless. So get a different brand. But you're never going to know if your level's right unless you keep checking it over and over again. So check it, fix it, check it again. It's not brain surgery.